Hello and welcome to Leever Cancer Conversations from the Harold Leever Regional Cancer Center. Today we're happy to welcome Dr. David Hill, MD, Director of Clinical Research at Waterbury Pulmonary Associates, to talk about lung cancer. Dr. Hill is chairperson of the National Board of Directors of the American Lung Association and assistant clinical professor of medicine at both Yale University School of Medicine and the Frank H. Netter MD School of Medicine at Quinnipiac University. Today we'll be discussing lung cancer, prevention, symptoms, screening, and treatment. Hello, Dr. Hill. You're very welcome.
Thank you for having me.
To get started, let's have you tell us about yourself.
Well, you've already given a bit of an introduction. I've been in practice here in Waterbury for about 28 years now since I completed my fellowship. I'm one of the partners at Waterbury Pulmonary. We see all aspects of lung disease, including lung cancer, where we mainly are involved in screening and diagnosis, and then we pass it off to colleagues for appropriate treatment. And I've been involved with the Lung Association, as you mentioned, for years, because they do the work that I can't do alone as a clinician. So they're able to advocate for policy changes on a statewide and regional and national level that go beyond what any one person can do.
Great. So let's get to lung cancer. In general, what can you tell us about lung cancer?
Well, lung cancer is unfortunately incredibly common and unfortunately incredibly deadly. So it is the most common cancer to cause death in both men and women. It leads to 3 times the rate of deaths of breast cancer, for instance, and greater than 3 times as many deaths as prostate cancer. So it's a very deadly cancer. Part of the reason why lung cancer is so deadly is it doesn't cause symptoms frequently until it has progressed beyond early stages, which is why screening for people at high risk is really important. The other thing people don't realize about lung cancer is one of the risks for getting lung cancer is having lungs. So people tend to associate lung cancer with smoking, but non-smokers are developing lung cancer at higher and higher rates. So in women, 25% of lung cancers are in people who never smoked. In men, about 20% who never smoked. There's a variety of other risk factors that can lead to development of lung cancer. Genetics and family history, exposure to radon, air pollution itself, all can lead to a higher rate of lung cancer.
Okay, well, let's talk about prevention. What can people do to help prevent lung cancer?
So I talked about smoking. Don't start smoking if you're a non-smoker, and that really means smoking or inhaling anything that is not prescribed by a physician. Cigarettes and any other tobacco products, including e-cigarettes and vaping materials. Smoking marijuana is probably not the right way to ingest that drug if you're utilizing it for medical or recreational purposes. If you live in a home, you want to have it radon tested, and you want to repeat that testing every few years to determine if you have elevated radon levels in your home. There are test kits that are available that you can get online, including through the Lung Association, and the testing is not very expensive, but it can be life-saving if you abate radon. And then if you are at risk for lung cancer, you want to talk with your physician about getting screened.
Who should be screened for lung cancer? I mean, is it everybody out there or is it just specific groups of people?
So right now, the current recommendations are for specific high risk groups. The way we screen is with what are called low dose CT scans. And the high risk category that's been identified through studies currently are people who are or were smokers with what we refer to as a 20-pack year history. So that would be smoking a pack a day for 20 years, or 2 packs a day for 10 years, or half a pack a day for 40 years. People who have stopped smoking for less than 15 years who meet that requirement would qualify. And you have to be between the ages of 50 to 80. Medicare tends to cut off the age at 78. So 50 to 78 or 50 to 80 would put people at the current eligibility for screening.
Great. So how would a person know that they actually have lung cancer? What are the symptoms to look for?
So unfortunately, as I said, until the lung cancer has progressed, often it causes no symptoms. And
Mm,
then when it does cause symptoms, they tend to be nonspecific and can overlap with a bunch of other medical problems. Lung cancer can present as a chronic cough, sometimes bringing up phlegm. It can present with chest pain or shortness of breath. It can present with pain elsewhere in the body, fatigue, weight loss, symptoms that are relatively nonspecific. Certainly, anybody having chest pain that is unexplained or a prolonged cough or definitely coughing up blood, any of those things are important things to discuss with the physician and seek further evaluation about.
okay. And how is lung cancer diagnosed?
Lung cancer is diagnosed initially on imaging in most cases. So, whether it is a CT scan done for screening purposes or a CT scan that is done for some other reason, typically an abnormality is found that leads to further evaluation. Once we have a patient who has an abnormal scan, we do further testing both with imaging or with biopsies to determine exactly what's going on. We may do what's called a PET scan, which is a different form of imaging, which looks with radiation for actively growing or actively inflamed tissue to help determine where cancer may be present and where it may have spread to. And then we would proceed with some form of biopsy if we have a suspicion for lung cancer. Those forms of biopsy can range from a radiologist sticking a needle into an abnormal area from outside the body to a pulmonologist going inside the lungs with what's called a bronchoscope to obtain tissue, or directly in some cases to surgery where a surgeon will remove the abnormality and make the diagnosis at the same time.
I see. If a patient is diagnosed with lung cancer, what are the different types of treatment that may be used?
The treatment possibilities range from surgery, sometimes can be curative. So for a earlier stage cancer in a patient who is healthy enough to tolerate surgery, surgical resection with removal of the cancer may be the only treatment that's needed. For more advanced cancers or for patients who can't tolerate surgery, there are other treatment options. And those options include various forms of radiation therapy. So, in some patients who can't tolerate surgery because of impaired lung function or other chronic medical problems, in early stage cancer, what's called stereotactic radiation therapy can actually be curative at rates that are very close to surgery. In more advanced cancer, treatment ranges from traditional chemotherapy using drugs that are designed to kill the cancer cells. And now we have more targeted therapies that are based on specific genetic mutations that the cancer may have. And we have what's called immunotherapy, which uses the patient's own immune system to fight off the cancer. Depending on the specific type of lung cancer the patient has and the markers that are found at biopsy, any of those therapies or some combination of them may be utilized in an effort to control or cure the cancer. The progress we've made over the past 10 or 15 years really has led to much higher cure rates and much higher remission rates. So we're seeing patients who have disease that is further advanced that we can control and turn into a more chronic illness and really give people a chance to live with quality for years despite having disease that previously would have led to bad outcomes.
That is good news.
It really is.
That's really great. Talk about the multidisciplinary conferences that are held at the Leever Cancer Center. How do they help patients with lung cancer?
Sure. So twice a month on Tuesday mornings, we have a multidisciplinary meeting over at the Lever Center, which started, it's probably over 10 years ago now. There were national standards that suggested this was something we should do, and the community came together. So the pulmonologist, the oncologist, the radiation oncologist, the radiologist, the pathologist, and the surgeons all come together in one room and we discuss cases and come to a consensus with how we feel people should be managed. Typically, I'll bring a case where I'm not sure what the right next step is or I think I'm sure, but I want to have other people weigh in and make sure their opinions agree with mine. It's a great place to really get a lot of expertise in one setting. We have hundreds of years of medical expertise in that room from a variety of specialties, and it leads to a more comprehensive approach to the care of the patient and to us making sure we're doing the most appropriate and safest evaluation and treatment for our patients in the local community.
Excellent. Do you have any other thoughts to share?
I think people should be concerned about lung cancer. They should also not be afraid to be evaluated for it, particularly if you fall into that high risk group. The Lung Association has a website called savebythescan.org where you can go and learn more about lung cancer screening. There's a quiz on that site that will go over whether or not you're truly eligible for screening. If you don't meet all the eligibility criteria but you're concerned, it's something you should talk to your physician about. Sometimes, if there are enough risks or concerns, there are ways your physician can evaluate you to make sure you don't have a lung cancer. And it's incredibly treatable nowadays. We really have made a lot of progress. It's not a diagnosis anyone wants to have, but we can help make people better.
That sounds great. Well, thank you so much for being with us today and sharing your expertise. And we look forward to talking with you again in the future.
Thank you for having me again. Appreciate the time you spent.